Welcome back. We all should do it, go to the dentist. But when do those biannual visits need to start for your kids? The answer honestly may surprise you. This morning, Joseph Lacoste, the wonderful founder and CEO of Louisiana Dental Center, is here with Robert Freeman, a pediatric dentist, to tell us more about not only when we should start taking our kids to the dentist, but how we should prepare for the visit as well. Welcome to the show, doctors.
Thank you very much.
Of course, you all look so well. Dr. Freeman, I have to start with you. Let's answer this question. What age should they start going to the dentist?
Well, a lot of parents are confused about the answer to this question. They bring their children in way too late, but the American Academy of Pediatric Dentistry recommends that you bring your child once the first tooth cuts, but no later than the first birthday. So it's actually a lot earlier than most people would imagine.
The first birthday, that is pretty early. And it's interesting, we were talking a little bit before this segment, that yes, it's important to take your kid before the first birthday, but when they're born, we should honestly start developing a good dental routine, right?
That's correct. You want to start establishing good habits early on and looking not only for cavities, but you're looking for developmental anomalies, things that you can address early in life and get away from a lot of problems that could occur.
Very interesting. Now look, my friends, the first visit is a big one. You all do a lot of things. Let's talk about the things you all do during the first visit with the children.
Well, first we start off with what's called a caries risk assessment. We are basically just determining whether or not they are at increased risk for cavities. We look at things like brushing frequency, snacking frequency. Do you put your child to bed with a bottle of juice? Then we will give what's called anticipatory guidance. We're basically just letting you know what you can expect. We look at feeding practices, oral development, fluoride, thumb sucking, injury prevention. We'll then do a knee-to-knee exam where the parent's actually involved in the examination. They will hold the child, lay the child back into the lap of the dentist, and we'll be looking for obvious cavities, any developmental anomalies, anything we need to address at that time. After that, we'll give health and diet counseling. We'll basically give you some do's and don'ts. Don't put your kid to bed with a bottle of juice, only water in a sippy cup, making sure that you have a lot of good information about ways that you can avoid problems. We'll then give oral hygiene instructions, things like how to position your child to brush their teeth, how much toothpaste to put on the toothbrush, then we'll give them fluoride, and then after that, we will give them an opportunity to ask any questions, address any concerns that they have.
How long is this first visit usually? My goodness!
It actually is super fast, believe it or not.
Really?
It moves pretty quick, but we just try to make sure that we give the parent enough information so they can avoid a lot of problems down the road.
That is very interesting to me. Should we be concerned if, for some reason, our child doesn't get that exam when they go to their first visit?
Well, it's important that you do it really early because you will see children that are 2 years old with every tooth rotten down to the gum line, and it's not uncommon. There's many days where I will routinely take out the front 4 teeth in a 2-year-old because they're all the way down to the gum line. And it's called baby bottle tooth decay. They will put their child to bed with a bottle of juice and it'll just sit there all night long and it'll be like acid on their teeth.
I cannot believe it. Looking at all of that, I bet the children are crying. Doctor, you I'm sure know this as well. Your center's been open for 40 years. What are some tips? Because honestly, if I was that age, I would be crying doing all of this, you know?
Well, I'll tell you one thing we want parents is to give their children a very positive, I guess, idea of what a dentist is or who he is or who she is, because there's a lot of lady dentists that we know. I will tell you there's been an explosion of ladies within the dental world, and it's really nice because, they get a woman's touch inside of a dental office is very nice as well. But parents really need to encourage their children that dentists are really good people.
They are. I loved going to the dentist.
Well,
I still love it.
A lot of parents will sabotage the visit by making it sound scary or making it seem like it's going to be a punishment for them. But it's very important to talk positively about going to the dentist. You want to make it part of a fun trip. For instance, if they've got a favorite restaurant they like to go to, tell them you're going to go see the dentist, then you're going to go to Chuck E. Cheese afterwards. So it's something they're looking forward to. You want to bring something that's familiar, like a toy or a blanket, something that they'll help keep them occupied while they're there. Arrange to have any siblings looked after by friends or family just so that you can focus all your attention on your child. And it's important that you fill out your forms ahead of time. That way, one, it moves faster, and two, you once again have all your focus on your child.
My goodness. As a pediatric dentist, I'm curious, what's that biggest, thing that you have to deal with? Is it crying? Are they moving too much?
Well, behavior management is definitely up there in terms of things that we have to deal with. Also, just making the parent feel comfortable is really one of the most important things, and that they trust you. So it's about building trust with not only the child, but also with the parent.
And also know that it is different because you're really a family dentist and you are a pediatric dentist. What's the big difference between you all?
Well, pediatric dentist is basically the pediatrician of dentistry. We do an extra 2 to 3 years of training, and we limit our practice solely to children, kids with special needs. So we're basically the primary and specialty oral health care providers for children from infancy through adolescence and kids with special needs.
And what's good is that you all have pediatric dentists at your locations, which is great.
We do have pediatric dentists at some locations, but what's really nice is that we have a group practice where we have the specialist and general dentist working together in collaboration. So it's really a special thing to be able to, as a general dentist, to be able to go next door in the next operatory and visit somebody like Dr. Robert Friedman and get his impression of maybe somebody that we're treating at the time.
Absolutely.
Well, LA Dental is honestly very unique in the sense that just what he said, I can go and literally go to another operatory and speak to the orthodontist at that time, or I can speak to a periodontist, or I can talk to an oral surgeon. All the specialties are basically are available at these locations, so it's very unique. We usually are practicing solely, and the only way we're going to be able to work with somebody is just to call them on the phone and try to get them when they're involved in their busy day. So
I hear that.
It's a very, very, very unique situation.
Teamwork is what makes the dream work. Well, look, gentlemen, thank you all so much for joining us this morning.
Thank you so much.
Absolutely.
Enjoyed
Here's
it.
some good news. They talked about orthodontics. We have a special offer for you. Louisiana Dental Center has a special offer coming up in May. You can get a free orthodontic consultation and $500 off customary fees for comprehensive orthodontic treatment. For more information about this special offer and to find one of the 19 South Louisiana locations near you, log on to ladentalcenter.com.